Welcome to AETCM, the emergency medicine channel. Today's our topic of discussion liver cirrhosis from the chapter of gastrointestinal emergency. So this is what our content in this presentation: definition, causes for the liver cirrhosis, clinical features, assessment points. So what are the things we have to assess in the pre-hospital region, and then diagnosis. So how we are tackle over, or how we are identifying the liver cirrhosis in the in-hospital region, complication, and then management. So management means we are going to see both pre-hospital and then in-hospital. So the definition of liver cirrhosis. What is meant by liver cirrhosis? So cirrhosis means your normal liver parenchyma is replaced by the fibrotic tissue or scar tissue, that is called the liver cirrhosis. So the term is very clear, normal liver parenchyma. So here you can see the normal liver parenchyma that is replaced by the scar tissue. Okay, here you can see the some region nodules also we can see this scar tissue. The architecture of the your liver also will modify, that is called the liver cirrhosis. Okay, so in this definition it is still more descriptive, like the cirrhosis is characterized by the irreversible chronic injury of hepatic parenchyma. So the key terms are, it is a irreversible, it is a that liver cirrhosis. Second one, it is a chronic injured. So if it is not treated means, so once after time your liver function will gets failure. So if the liver failure happens means, then it will progress into the fibrosis. So these are the, then it will leads to the liver start to failure, then it ultimately leads to the liver cirrhosis, the formation of fibrosis or scar tissue, regenerative nodules. So this is called the liver cirrhosis, and then liver cirrhosis stages, progression stages. And then what might be the causes? First one is a alpha 1 antitrypsin deficiency or autoimmune hepatitis. So we have to know about the what is mean by alpha 1 antitrypsin deficiency. Before that, we have to know what is mean by alpha 1 antitrypsin. Who is he? So alpha 1 antitrypsin is one of the protein that is secreted or that is produced in our liver. Okay, this is one of the protein that is produced in our liver. So what is the role of the alpha 1 antitrypsin? Means it takes a role, it will produce in the liver, and then it will move on to your lungs. There it will take a protective action. Protective action means, so if any inflammation, so it will protect against inflammation or dust or any smoke particle, means it will protect the lung from the inflammation and then other smoke and then dust particle. That is the role of the alpha 1 antitrypsin. So it is one of the protein. So what will happen in the case of alpha 1 antitrypsin deficiency? So in the case of alpha 1 antitrypsin deficiency, in your liver, that will produce more amount of alpha 1 antitrypsin. Alpha 1 antitrypsin, that is the one factor. So it will produce more amount of alpha 1 antitrypsin. Mean the same time, from the normal shape, that in the deficiency case, that protein shape will differ. So if it is in a normal, it is a normal shape, means in the case of deficiency, the shape of the protein will differ. So these are the two entity will occur. First one, large amount of alpha 1 antitrypsin will secrete. Second one, the shape of the alpha 1 antitrypsin also will differ. So because of that, what will happen means, if the shape is changing, means what will happen? So the whatever secretion that is happening inside the liver, that can't propel out or that can't come out from that liver. So automatically the congestion of the content will happen inside the liver itself. So because of that congestion, what will happen? Leads to the failure, and then finally it leads to the cirrhosis. So this is the thing will happen in the alpha 1 antitrypsin. But Chiari syndrome, biliary syndrome means hepatic venous outflow obstruction. So here it will the occlusion or obstruction. Cirrhosis, keep in mind the cause is very simple. Because of the congestion only the cirrhosis will develop. So congestion, the first part we told, the congestion in the alpha 1 antitrypsin. Second part, in Budd-Chiari syndrome, where the congestion is occurring or obstruction is occurring, means hepatic venous outflow. So the cirrhosis means, so you have to think about the your congestion. Okay, so cirrhosis means CNC, cirrhosis congestion. And then third one is a chronic viral infection, any hepatitis B virus or C virus cholangitis, inflammation of your gallbladder, and then drugs like methotrexate and then methyl-dopa. So methotrexate, it is one of the drugs where we are using in the chemotherapy, and then methyl-dopa, it is a alpha-2 agonist or antihypertensive medication. Ethanol, and then fatty liver disease, genetic disease like a hemochromatosis. Hemochromatosis means chromo means that is a iron, so increased iron load in our body. Cystic fibrosis, so again cystic fibrosis means it is one of the genetic condition. Mainly what will happen in a cystic fibrosis means, so wherever the secretory function is occurring, the viscosity of the fluid will increase. Means if the in the salivary gland, the viscosity of our saliva will increase, so it will be, the fluid will be in a more thick in nature. So that is the condition called cystic fibrosis. And then glycogen storage, this is heart failure, there is a cardiac cirrhosis. Means cardiac cirrhosis means the same congestion. So here the, if the right heart gets failure means what will happen, so the all the your venous return that will stagnate, the venous blood will stagnate in the inferior vena cava, ultimately it will stagnate in your portal system, and then so it leads to the all over congestion, right? So the same thing only will happen in the liver cardiac cirrhosis. Cardiac cirrhosis mainly because of the right heart failure, and then idiopathic causes also one of the thing. So assessment points, so here we have a two initial stage of the disease, that is a first phase. Second thing is a, once if the disease get progress means what are the clinical features will occur. First the initial progression of the disease, the person will experience joint ache, weakness, fatigue, nausea, vomiting. So joint ache because of, so we told autoimmune hepatitis also one of the cause. So if any autoimmune arthritis or rheumatoid is there means, the ultimately it leads to the joint ache. So weakness, fatigue, nausea, vomiting, anorexia, urticaria, and then pruritus. Pruritus, urticaria because of the accumulation of bile salt inside the body. So automatically the bile salt will deposit under our skin, it will develop the itchiness. So in this case the person may misdiagnosed with the influenza and then gastroenteritis also. So once if the disease get progress into next stage means, here the person will develop some other signs and then symptoms visibly we can see. The first major thing is a congestion of your bile salt or congestion of the bilirubin. Because of that congestion we can see the jaundice, icterus conjunctiva, and then ascites we can see. And then one more thing, signs wise, alcoholic stools and then darkening of the urine also we can see. So these two things because of the, so mainly because of the that accumulation of or congestion of bile inside the body. So because of that normal stool, alcoholic stools means the stool color will be in a white in nature or it will be in a clay colored stools. So darkening of the urine, again the same thing. So because of that all bilirubin will be stays in your body. So the excretion part will be none or very low, because of that color will change and then darkening of the urine will occur. Ascites mainly because of the portal hypertension. So this is the reason for the ascites. So ascites, how we can see, so abdominal grit we can check it at the umbilical level. So you can measure the abdominal grit hour by hour or based on that a prescribed interval we can check, thereby we can assess the ascites in the pre-hospital. If it is in hospital for ascites rule out, we can go with your ultrasonography is one of the major factor we can use for. And then the person will have abdominal pain mainly in the right upper quadrant, and then while palpation we can check out the, we can get the hepatomegaly also. So patient may also have a dilation of blood vessel surface of the abdomen, mainly around the umbilicus, that is called the caput medusa. Caput medusa, okay. So caput medusa, the other name for the caput medusa, that is called the palm tree sign. Palm tree sign. So that's we can see the some enlarged abdominal veins. Okay. This is also mainly because of the portal hypertension. The portal hypertension, what will happen? So the resistance to the blood flow will increase. So mean the same times if the resistance is increased means the flow will get obstructed or it will stagnant in this area. That is the reason for your engorged vein. So this is the clinical features. So system wise we given like a neurological hepatic encephalopathy, peripheral neuropathy, gastrointestinal wise dyspepsia, anorexia, nausea, vomiting, hematemesis, and then varices also will occur, reproductive system impotence, amenorrhea, and then testicular atrophy, gynecomastia, cardiovascular system wise fluid retention, peripheral edema, ascites will occur. In metabolic ways, hypokalemia, hyponatremia, hypoalbuminemia. So hyponatremia is one of the major factor that we have to note it down in the liver cirrhosis. Hypoalbuminemia because of albumin mainly that will produce in the liver. So whenever the liver function gets failure means the production of your albumin level will also reduce, that is called, that will cause the hypoalbuminemia. Hematological wise, anemia, leukopenia, coagulation disorder. Again, coagulatory factors will secrete in your liver itself. So whenever the function gets failed, again the coagulation disorders will also happen. In documentary ways, we can notice the jaundice, caput medusa things also. So in hospital, how we are diagnosing means, so we can go with an AST or AST and ALT or SGOT or SGPT. So bilirubin level also we can check, albumin level also we can check, prothrombin time. So because we told albumin and then prothrombin, that coagulation factors, coagulation profile mainly will secrete in your liver itself. So whenever we want to know the status of the liver, we can check the albumin and then prothrombin time. So as like we told, hyponatremia is one of the major factor we have to rule out, and then liver biopsy also they will go for. And radiological finding ways, so radiological ways, ultrasonography, computer tomography, or magnetic resonance imaging also, that is one of the indicator things. So whenever needed they will go. The main finding ways, the liver will be in a sunken liver, the architecture of the liver will be in a irregular manner, nodule also will be there. So elastography, it is one of the non-invasive technique. So they will place some probe over that whichever area. So here liver means they will place over that right upper quadrant above the liver, and then they will check that stiffness of the liver. That is it is one of the non-invasive technique. So again, this is the one of the classification. So the whatever diagnosis in hospital, and then this classification, child book classification, this is for only for the knowledge or remembrance only. So in child book classification, we have we will based on the 5 items we will classify the person. Here the minimum score is 5, maximum score is 15. Okay, so each have a three points. So first two things based on your clinical features are based on the signs, ascites and then encephalopathy. Remaining three are based on your laboratory values. So first encephalopathy, if the signs or clinical features of encephalopathy is not there means, then you can give us a 1. If it is a mild hepatic encephalopathy is there means, then you can give us a score of 2. If the marked hepatic encephalopathy clinical features are there means, then we can give the score of 3. So ascites also same, no means 1, mild means 2, marked means 3. So and then coming into bilirubin level, so it is a total bilirubin level. So normal we know it is about less than 1.2 milligram per deciliter. So if less than 2 means we can give the 1 score, 2 to 3 means we can give the score of 2, it is greater than 3 means we can give the score of 3. And then albumin also, the normal we can know 3.5 to 5.5 or 5. Okay, so the level if it is more than 3.5 means we will go give a score of 1, 2.8 to 3.5 means give a score of 2, if it is a less than 2.8 means score of 3. And then coming into prothrombin time, again that here the seconds will prolong. So if it is less than 4 seconds, 4 to 6 seconds, more than 6 seconds, from the normal it is prolonging means, so based on that we will give a score. At final we will add, and then based on this less than 7 means that is a child A category, 7 to 9 means child B category, more than 9 means that is a child C category. Finally complications, so it will because of that liver cirrhosis it will affect the major vital organs. First it will affect your brain, that will cause a hepatic encephalopathy. Second, hepatopulmonary syndrome. So in your if you are doing that endoscopy means there will be a microscopic, so minimal level, there will be a dilation of arteriovenous will be there. So that will happen in the hepatopulmonary syndrome, and then hepatorenal syndrome also will occur, ascites we told, and then variceal things also will occur, esophageal varices, and then stomach, your duodenal varices. So everything there will be a varices also occur. Finally, management. So these are the common thing what we are doing in all emergency. The main common things here we have to remember in a pre-hospital: first one, bleeding control; second one, medication administration. So these are the both entity we have to keep in mind, because bleeding control we told there will be a problem, or there will be a production failure in the coagulation factors. So here, so whenever you are going to perform your IV cannulation, there we should not do the 3 or 4 attempts. Try to get a within a 1 attempts. So that is also we have to take care in a bleeding control. Otherwise, while handling a person, we have to handle very carefully. We should not allow them, or we should not make any unnecessary puncture. And then again, arterial puncture also should not be done in the case of liver cirrhosis. And then mainly we are focusing on the bleeding control. Second thing, medication administration. Why medication administration? Means already the liver in failure state. So we know liver is one of the major factor that will act in the metabolism of drug, and then clearance of the drug from the body. So if the function of the liver get diminished, means again with the same dose, so whatever dose we are administering in the healthy liver cases, the same thing here we are administering, means what will happen, that cumulative effect, or that drug won't metabolite easily, and then it will accumulate in your body for a longer time. For that reason, what we can do, so what is the normal range? From that normal range you can administer low level, lower than the normal dose we can administer. So these are the things we can straight away we can consult with our representing physician, and then we can go for. So the same thing, and then in-hospital management. See, so these are the things is in-hospital. So pre-hospital, bleeding control, and then mainly the medication administration is one of the thing. In-hospital management wise, slowing or reversing the progression of liver disease, preventing superimposed insult of the liver. So how we can do these other things means, if the person have a history of alcohol, means so we have to advise the person to avoid the alcohol. And then again, if it is the liver cirrhosis because of any infection like hepatitis B virus or C virus, means we can treat the disease. So before that we can advise the person to take vaccination. So those are the some steps we can do. Still some studies are recommending the use of non-selective beta blockers, also useful in the case of preventing the progression of the disease. So like sotalol, those are the drugs we can use in the to prevent the progression of this disease. So some studies are recommending, but in still it is in the clinical practice not it came, some of them recommending, some of them against of that statement. So that again, based on our institutional protocol, we can go for. And then identifying medication, that as like we told, so we have to adjust the dose of the medication. And then some, if any are finding any laboratory abnormalities or laboratory derangement in the values, means that we have to treat hyponatremia, umbilical hernias, thrombocytopenia, elevated INR level. And then we have to preventing and identifying and treating the complication of cirrhosis. So we told hepatic encephalopathy, and then hepatic pulmonary, hepatic renal. So those are the things we have to rule out, and then we have to treat, determining the appropriateness, and then optimal time for the liver transplantation is one of the definitive treatment. So in this, we have to think about the airway management also we have to keep in mind. So hepatic encephalopathy, next presentation we are going to detailedly discuss. So we'll see in the presentation. So do your best. Shalom.